Hi guys, this is Preeti and you're watching Med Solution. In this video, I'll be teaching you about what is the difference between the congestion and hyperemia. Congestion, because of this congestion, we can see various disorders like CVC, lung, liver, spleen, kidney and all. Before studying those CVC, lung, liver and all, the pathogenesis of those, we have to understand what is the difference between the congestion and hyperemia. Hyperemia, it occurs in arteries, whereas in congestion, it will be in a venous congestion will be the hyperemia. It occurs in arteries. So first I'll say what is hyperemia. Hyperemia means in arterioles it undergo dilation. Vasodilation will be there, so increase in the blood flow. So it appears redness. Redness you can see rubor and calor. Rubor is a redness and calor is a increase raised in the temperature. This is a calor. These two you can see in hyperemia. For vasodilation, it is an active process. It requires energy. This is an active process. It actively dilates and then increase blood flow. You have seen during inflammation there will be vasodilation, increased blood flow will be increased and increased vascular permeability. All this you can see in hyperemia, which is an active process, whereas congestion is a passive process. Congestion means you consider this as a tissue, you consider this as a kidney. There will be renal artery and renal vein. Renal artery gets the blood to the kidney, whereas renal vein drains the blood back into the inferior vena cava. This artery gives the blood, but venous there will be congestion, so there will be accumulation of the venous blood inside the this kidney only. This is called as a congestion. It is a passive process because there will be congestion in the vein, and the cause will be impaired outflow of the venous blood from the tissue. This is a tissue. Kidney is a tissue. There is a impairment in the drainage of the venous blood. I think you understood what is the difference between this congestion and hyperemia, which is a passive process. Congestion is a passive process. Hyperemia is a active process. It occurs in the vein, whereas these occur in artery. This is due to the impairment of the drainage of the venous blood from the tissue. This occurs due to the increased outflow of the blood, from increased flow of the blood in the blood vessels due to vasodilation. Because of that increased blood flow, increased RBC increases, hemoglobin increases, color it appears red, so redness, that is called as a rubor. Whereas blood, the functions of blood maintains the temperature. Wherever the blood flow is increased, there will be raised in temperature. This is called as a calor. These two are the two cardinal signs of the acute inflammation. And this is all about the difference between congestion and hyperemia. Now we'll see what will happen if left heart failure will be there, and when right heart failure will be there, what it results in. When there is a left heart failure, we'll see there is heart has 4 chambers. This is a right atrium, right ventricle, left atrium, left ventricle. This is a picture of the heart. If there is a left heart failure, the ventricle stops pumping. There will be increased pressure in a left atrium, raised pressure in left atrium, which will be shifted into the pulmonary vein. Left heart will will receive oxygenated blood from the pulmonary vein. So pulmonary vein, there will be increased pressure. This increased pressure in the left atrium is transferred into the pulmonary vein. Pulmonary vein will be supplied into the to the lung. From lung it will be coming. There is a lung. From lung the pulmonary vein will be coming. That causes there will be congestion. Increased pressure will causes congestion in the vein. This causes CVC lung. You can see CVC lung is caused. Once again I'll say, this is an heart. Heart has 4 chambers: right atrium, right ventricle, left atrium, left ventricle. Left atrium receives blood from the pulmonary vein from the lung. So when there is a left heart failure, there will be raised in pressure in left atrium, which is transferred back into the pulmonary vein. But there is an increased pressure. So blood flows from high pressure to low pressure area. So lung will be having less pressure. So all the blood is accumulated inside the lung only. So it causes CVC lung. Accumulation of venous blood in the lung is known as CVC lung. This is about all about the left heart failure. Now I'll say about the right heart failure. Again, if we consider this as a heart which has having 4 chambers: right atrium, right ventricle, left atrium, left ventricle. Now there will be right heart failure. So right ventricle cannot fails to pump. So increased pressure in the right atrium. There will be increased pressure. This will be because right atrium will be receiving a deoxygenated blood from the aorta. So superior vena cava and inferior vena cava, if the right atrium will be receiving deoxygenated blood. So again there will be back in the pressure, there will be a pressure, this pressure, increased pressure in the right atrium is transferred backwards, that is to superior vena cava or inferior vena cava. So there will be systemic venous congestion. This will lead to superior vena cava, inferior vena cava. This will be supplying this liver, spleen and kidney. So there will be increased blood, venous blood, like the accumulation of the venous blood in the kidney, spleen and liver, venous blood. This causes CVC liver, CVC spleen and CVC kidney. If you understand this everything, there will be right heart failure, right heart failure, right ventricle fails to pump. So increased pressure in the right atrium, this will be transferred, this pressure is transferred into the superior vena cava or inferior vena cava. So here pressure will be high, so blood moves from high pressure to the low pressure area, that is into the kidney, liver or spleen. This causes accumulation of the venous blood in the kidney, liver, spleen, which is known as CVC, liver, lung and spleen. This is all about the how the CVC, that is chronic venous congestion is caused in all these organs I have discussed. So when I'll be discussing about the CVC lung, I'll be saying, I said already reason what is this, the cause will be same, that will be left heart failure in CVC lung, whereas in CVC liver this will be right heart failure. This is all about the difference between the congestion and hyperemia, and what will happen if left heart failure will be there and right heart failure will be there. If you find this video helpful, please do like, share and subscribe to my channel. Thank you.